And she's in New York City, are you not?
No, I'm in a suburb of Chicago.
Oh, okay, I got you confused. All right. So she's in Chicago, and she's just back from her yoga class, and she's involved with all kinds of activities. Welcome, welcome, Sandra. It's good to have you here on board with us. Uh,
Thank you. It's great to be here speaking with you.
okay. Well, tell me about your background. You have a PhD, do you not?
I do. I have a PhD in clinical psychology. My original background was as a teacher. I have a master's in learning disabilities, and I spent a number of years in a classroom as well as teaching teachers, supervising practicum students, getting their degree in special education, and then I got my doctorate in clinical psychology, worked in private practice for many, many years. My specialization has always been in mind-body medicine. But recently, I have gone through the training program in functional medicine through the Institute for Functional Medicine and became certified as a functional medicine practitioner.
Great. Well, what what drew you to functional medicine?
Well, I was always interested in the role of nutrition. I was always interested in the looking at root causes. And I happened to come upon a website of the Institute for Functional Medicine and saw they were having a conference, and the conference was focused on mood disorders, a new way of looking at mood disorders. So I signed up, and that was it. I just fell in love with this approach, and it's a way of looking at illness from a different perspective instead of just looking at symptoms and naming those symptoms, giving them a name. This person has depression, this person has this set of symptoms, so we'll call this anxiety, for example. It's looking deeper. It's looking at the root causes, which might be traced to inflammation, and then for example, and then it looks at the causes of the inflammation. So we're now looking at the causes of the causes, which gets down to the modifiable lifestyle factors, and those are the areas that I believe psychologists can really have a tremendous impact. It's looking at having a sense of purpose in life, for example.
Yes. Well, now you've said something kind of provocative here, so let's flesh that out.
Sure.
A lot of people would say they know the root causes of anxiety and depression, and it's in dysfunctional thinking. You have to correct the thoughts if you're going to get a resolution of the symptoms. What about that?
So that is absolutely right. I spent many years studying cognitive behavioral therapy. I was fortunate enough to have trained with Albert Ellis, and I still use cognitive behavioral therapy in my counseling and my coaching. But what happens if your dysfunctional thinking is caused because you are eating too much sugar, you are not sleeping well, you are not exercising, and you have disrupted the gut? And we know that there's a strong connection between our brain and our guts, and when we heal the gut, then changes happen systemically. So we were looking at factors that years ago we used to thought they never would cross the blood-brain barrier. In other words, how could your brain get inflamed? Now we know that that is happening. So that's what intrigued me. So now not only do I focus on helping someone identify and then change their irrational thoughts, but I'm also asking them, what did you eat all day? What did you eat yesterday? So how could that be contributing to your mental state or your thinking?
You know, just today, just this morning, Ken Pope sent out a press release from, and I don't remember, I just glanced at it, but it says essentially that looking at the brains of people with autism, and the only way you can look at their brains is with an autopsy. In other words, you need a sample of brain tissue, and they found now that autistic people, I should say it that way, autistic people have enormously inflamed brains. Now, when I went to grad school in the 1970s, the incidence of autism was very, very low, something in the neighborhood of 4 in 10,000 births. Today, it's 140 in 10,000. Now, some people say it's 1 in 83. I don't know about those numbers. I'm uncertain. But the point is, something is making autism become more and more frequent. Just the other day, there's a study about how depression is becoming more and more frequent. What do you think? Can you tie that into inflammation?
Absolutely. There's been some groundbreaking work in that area. Martha Herbert, who's at Harvard, I've heard her speak, and she has some very groundbreaking research that she's doing, tying the tying autism to, for example, gluten. And when they take kids off a gluten diet, they go through an elimination diet, and many of them will experience some significant changes. It's often much more complex than just removing gluten, but functional medicine looks at removing the bad stuff, putting in the good stuff. And so looking at what do we need to remove? What's being put into the body that may be driving inflammation? So certainly diet, too much sugar, too much processed food, too much gluten, which is now in so many things. It's not our grandfather's gluten anymore, for example. So it's taking those out, and then what's missing? So is our body's ability to absorb nutrients impaired? Do we need to beef up digestion? Do we need to look at helping the body absorb nutrients? Do we need to put in extra nutrients? So that's certainly a big part of it. So yes, we're just beginning to explore the role of inflammation in so many conditions. And of course, functional medicine doesn't just look at one condition in isolation and send you to a specialist for each area. So, oh, you have depression, you have to go to a psychiatrist, a psychologist for this, you have to go to a cardiologist for heart disease. Ties together, why are all these conditions happening at this particular time?
Yes, and is there any evidence that inflammation is increasing? You just one of the things you said is our wheat is not our grandfather's wheat. Well, could that be part of why we have more inflammation?
Absolutely. I was fortunate enough to have heard Dr. Alessio Fasano at a symposium, and he is doing very significant research at Harvard on gluten. And is this tied to inflammation? Because when you eat something with gluten in it, which is in wheat, barley, rye, and now in so many of our processed foods, which often contain ingredients such as MSG, for example, what that does is it changes the tight junctions that are involved with the lining of the small intestine, how we take in nutrients. So what it does is acts on what's something called zonulin, which causes those junctions to open in a way that will allow larger molecules to drop in. So now your immune system detects those larger molecules and says, what's this? This is not me. The immune system's job is to distinguish friend from foe. So when these larger molecules drop in, like, whoops, you ate Cinnabon. Well, is that me or is it not me? Well, that's not me. It's not an amino acid. It's not going to break down into a fat that will become part of our cell membrane, for example. So the immune system will mount an attack. And that attack, then that's the inflammatory process developing. So there's been...
Go ahead.
There's a lot of concern of what we are consuming, and particularly what we're giving to our children. So the incidence of the brain is exquisitely sensitive to to nutritional deficiencies, to the effects of increased toxic load. We're living in a toxic world, so it's not just food choices, but it's what's in our food, what's in our water, what's in our air, what's in our personal care products. These are all having a very significant impact.
Well, that's a huge challenge you're giving us. I mean, what hope is there?
Yeah. Well, this is the conundrum, because we don't want to develop anxiety as a result. We don't want to be living in constant fear, and this happens quite frequently. And I'm guilty of this myself. I'll go into a restaurant and I look at the menu and I can't eat that because of the mercury in the fish. I can't eat that. It's not organic. So it's possible to have an anxiety reaction. So it's finding balance, and that's where we always come back to finding balance, finding the joy in eating, for example, but at the same time taking reasonable steps to make sure that you're choosing organic when possible, that you are lowering toxic load. I guide clients towards sites like the Environmental Working Group, where you can look at the dirty dozen as far as fruits and vegetables. You can look at safe personal care products, and so you can, again, start taking out the bad stuff, lighten the load.
I probably get a list of these things from you, these people in that Environmental Working Group, and post it on my website later for people to follow up. If you're able to send that to me, then I will. People can go to drlynnjohnson.com and look for a blog that says functional medicine. I'm going to do a blog posting after this about this. So functional medicine has a lot to do with really tuning people into healthier eating. Fair?
That's one area, yes. So looking at what people are eating is extremely important, but it's also looking at many other areas. In functional medicine, we start by having someone tell their story. So that's very similar to what I was trained to do as a psychologist, to listen to. And functional medicine in their training programs for physicians teaches them how to engage in that listening process, to listen to someone's story. And what we're listening for are some of the antecedents, so those are the factors that came before your family history, some of the conditions that may have been occurring early in your life. We're also looking for what are the triggers. So if someone comes in and they say that they have now have irritable bowel, and they have hypertension, and they have one symptom, they're obese, they have metabolic syndrome, and then they say, well, when was the last time you felt well? And then what was going on maybe a year, 6 months before that? And often they'll say, oh, they moved, they have a new job, they got a divorce. So we're looking at those triggers, but sometimes the triggers are not just those emotional crises or stressful events, but they may be events that are stressful to the body. So if you moved, maybe you were doing a lot of renovation. Maybe you had a lot of then toxic exposure to some chemicals. Maybe some of those antecedents are the fact that you have old amalgam mercury-containing fillings, dental fillings. So that's another red flag. So in functional medicine, we look at all of those factors. We do what's called a timeline, and someone tells their story, and we make note of that. And then what are the perpetuators? What is going on that's continuing to irritate the body? Again, continuing stress. It could be that they work in an occupation that again is exposed to toxins. Maybe they're a manicurist and they're exposed to the formaldehyde in the nail polish all day long. So we would take that into account.
Nail polish has formaldehyde in it?
Nail polish has formaldehyde. Yes, there are many brands that now are starting to remove some of it, but they have about some nasty chemicals. So the more awareness that someone develops in some of these areas, it'll help them to see what's going on. So for the classic example that use, for example, someone comes in and they're depressed. So or they're anxious. Well, years ago, I would have looked at, okay, I would have labeled it, what kind of depression, what kind of anxiety, and then what type of, we're going to develop a treatment plan. But now I want to dig deeper. So I say, well, maybe they're depressed because they've had a significant life crisis. Maybe they're depressed because they eat sugar all day long and that's driving inflammation. Maybe they're depressed because they don't
Wait
get
a minute. Wait a
outside.
minute. Sugar, innocent little white sugar, makes you inflamed?
Oh, absolutely. Sugar drives inflammation. It is what we used to think sugar, oh, it's just empty calories, but it's not, you're not getting nutrients, but it's not bad for you. We know that that is not true. There's a lot of research that is linking sugar to inflammation. And what it does, the reason it's because it leads to insulin dysregulation. And insulin dysregulation is connected to other pathways in the body that drive an inflammatory response. So the immune system is linked, and that's one of the most exciting principles in functional medicine. It's like you imagine the body as this big matrix, or the old-fashioned switchboard operator of a telephone company where there's all this crosstalk, and wires are just connecting back and forth. Every system, every cell is talking, communicate. So it drives a signaling mechanism. It stimulates something called NF-kappa B, which is a signaling mechanism, and we're now learning there's an exciting field called nutrigenomics that's looking at how DNA is expressed. And so it's a messenger that says, turn on inflammation. Or if you eat a piece of broccoli, it's a different signaling mechanism that turns off inflammation.
Mm-hmm. Okay. Okay. So, and I pointed that out because I think a lot of us have grown up with that idea of, yeah, sugar isn't good for you because it's empty calories, but I don't think, at least people that were educated in the 70s and the 80s and the 90s, we didn't hear anything about sugar causing inflammation. In fact, we didn't hear anything about inflammation being linked to any kind of mental, emotional disorder, did we?
Absolutely not. And now I suggest when someone gets their annual lab workup, they go back to their doctor and they ask for some markers of inflammation. There's one that's a good one in particular that is C-reactive protein. It's a measure of inflammation. So sometimes you could use some lab tests that will give you some hints as to whether you are in an inflammatory state. My personal example, when I was in grad school and my first teaching job, for example, I had a serious addiction to sugar. Sugar, we now know, is 8 times more addictive than cocaine, heroin, and this has been replicated a number of times in some animal studies. They go for the sugar water. They leave the hard drugs. They don't want that. They want the sugar. And so that was me. I was completely addicted to sugar. And then I thought, well, on days when I wasn't trying to cut down on sugar, I would eat things like carrots and oatmeal for breakfast, not realizing that that turns to sugar as well. So I was eating the sugar diet 24/7, and no wonder I was having panic attacks and I was anxious and not feeling really good. So in looking at, for example, if someone comes in and they're depressed, they're anxious, I will want to know that, because again, one person with depression, it could be because they're eating sugar all day long. Another person might not go out in the sun and they're vitamin D deprived. That contributes to depression. Someone else may be depressed because they never eat fish and they're omega-3 deprived. Another person could be depressed because they eat too much fish, particularly sushi, and they're getting too much mercury, and that is linked with mental disturbances as well. So it's much broader. That's what digging deeper is.
Oh, that's very complex. Okay, so thank goodness for aspartame.
Oh yes, not really.
Okay,
Because,
let's hear the bad news about aspartame.
well, aspartame, they're just finding out. There's been some really eye-opening studies that shows that it stimulates the pleasure centers of the brain, just like sugar does. And so you're tricking your brain to think that it's a taste of something sweet, and what happens? You want more of that wonderful taste of something sweet. Nobody significantly lost weight by drinking diet soda. It's also there's some concern that it's an excitotoxin, and there's some concern about the long-term impact on brain health. There's some cancer studies as well, but the main area of concern is that this is just going to cause you to want more sugar.
So if I drink Diet Coke, it won't help me lose weight?
It will absolutely not. There's a fallacy that a calorie is a calorie. So if you take a calorie, it is not. So it's just because it has 0 calories is meaningless. It's the chemical ingredient. So you read the ingredients in that can of Coke, diet soda, and you've got caramel coloring, and you've got chemicals. It's that a third grader, there's a rule. I love Michael Pollan, food rules, and you shouldn't be eating anything a third grader can't pronounce. And there's a lot of chemicals in that diet soda a third grader would not be able to pronounce. Well, those chemicals are disturbing that toxic load. The brain is one of the first systems to be affected by chemical overload. So we really need to watch for that.
You used a word that I don't know that I might understand. Maybe you could explain it. Excitotoxin.
So, okay, well, when we look at stimulate, so the receptors like GABA, which would be the opposite, so you'd want to get a calming response, and the excitotoxins would be those substances that are going to really stimulate those excitatory pathways in the brain, and so it puts you on edge. There are other foods, other substances. I'm sorry.
Oh, you cut out there for a second. I think I stepped on you. Say that again.
That there are wonderful substances that are calming, that stimulate GABA in those receptors that are more we consider calming.
If I'm nervous, can I calm myself down by changing what I eat?
Absolutely. So I guide people to have an approach that is helping them to find balance in their life. So we look at a number of factors. So nutrition is one. We also look at, are you well hydrated? We would look at, are you getting enough sleep? Because sleep is when we restore, repair. Are you dealing with too much stress? Do you have a way to relax? Do you have a sense of meaning, a sense of purpose? What's your social network like? So we take into account all of those factors. So we're looking at the traditional factors that as a psychologist I had always looked at, but now I'm adding a bit more and asking questions about those areas.
I disagree. You're adding a lot more. You said a bit more, and I think, well, now, a lot of my listeners are therapists. A lot of the people who are going to watch this video are therapists. And let's put ourselves in their shoes for a minute. Wouldn't this sound a little overwhelming?
So, well...
now do I have to go back and get an MD degree? Do I have to go back to school? This sounds very difficult.
Yeah. It was to me at first, and when I went through the training through the Institute for Functional Medicine, it was very hard because the last time I took chemistry, I think, was in high school. I never even took organic chemistry in college, and so I had to really learn a new way of a lot of new vocabulary. But then my training was always as a health psychologist, and for many years I was on staff at large hospital systems and was called in to do consultations, for example, in the area of psychosocial oncology and health psychology. So I had to chart, and as I charted, I really had to understand the lingo of the medical doctors. If I was reading that someone has stage 4 metabolic cancer with Mets to this and this area, and she's on this particular drug, I had to know what they were talking about, and I had to write in their language when I charted as well as I was going into.
Oh, did you freeze up there? Oh, I wonder if we have a freeze here, Sandra. Can you hear me, Sandra? You may want to refresh if you can hear me, refresh your screen or something so that we get a better connection. Well, so Sandra seems to be frozen up, and for all I know, I'm frozen up on her end. I hope that the people that are watching can at least hear me. I'm going to put in a plug for Roger Walsh's article. I think it's 2011. Roger Walsh is a psychiatrist at UCal Irvine, and he's also a psychologist, by the way. He's got a PhD and an MD, and he's a former circus acrobat, and he's one of the world's experts in meditation. He's written some phenomenal stuff on meditation. So Karen says, I am not frozen. Thank you, Karen. Appreciate that. So somehow we've frozen up Sandra, but anyway, so Roger Walsh, and if you Google Roger Walsh and lifestyle interventions, there, now I'm going to post that on the Roger Walsh lifestyle interventions. One of the places you can go is to find his website, where he talks about 8 lifestyle interventions, such as the ones that we're talking about here, like social connection. I know, for example, well, we were talking about social connection. Are you in a book club? Are you in a running club? Are you in a sewing circle? In other words, do you connect with people? And that turns out to be an important factor. Let's see here. Oh dear. Okay, so Sandra is not showing up. Well, I hope we haven't lost her, because this was really getting interesting. What are we, about a half hour into this? If we can't get her back, then I would just summarize by saying this Institute for Functional Medicine sounds very interesting to me. It sounds very attractive. If I were starting out again as a young psychologist, I think I would be interested in that. Now, okay, yeah, it says Sandra is no longer presenting. Yeah, I know that. Get her back. Oh, there she is. She's back.
I think we had some technical difficulties. The connection was lost, but
you are absolutely correct as usual, King Friday. We had technical difficulties. Now, let me tell you what I was doing while you were offline. I talked about Roger Walsh's 2011 article on lifestyle interventions in medicine, and I mentioned that even if it sounds to our therapist audience that this is a lot of work, learning all this stuff, if I were starting out again, I definitely want to be getting some real solid training in this, because, and let me just, as long as I've got the floor, I'm going to just indulge myself and tell one story. May I do that?
Absolutely.
Okay, so we all know, do we not, that depression is all about dysfunctional thinking. Everybody knows depression is about dysfunctional thinking. 67-year-old patient comes to see me. He's been on, count them, 1, 2, 3 different antidepressants, all without any effect. He'd seen a counselor, all without any effect. And I thought, I can't do the same thing. And I was talking to him about, well, what's different about times when you do feel good? And he said, oh, I don't know. I don't think I ever feel good. And his wife spoke right up. And I invite spouses whenever I can because I think it's useful to get a different set of eyes and ears on the problem. She said, I know when he feels better. It's when he will go for a walk with me. She walked every morning for 30 minutes, just clockwork. And sometimes she could talk him into it and sometimes she couldn't. I said, really? Isn't that remarkable? And so we discussed, well, how do you decide to cooperate with your wife? Now, I was using an outcome measure called the OQ45. On the OQ45, if you're below 63, you're considered to be in the normal range. He came in, he was about 87. So he was in need of psychotherapy. And we talked about how could he kind of knock the depression devil off of his shoulder that says, oh, it wouldn't work, oh, it'd be too hard. Knock that devil off your shoulder and just go ahead and do the walk, right? Well, with no other intervention, within about 6 weeks, he was down in the low 50s on the OQ45. In other words, he was well over fully recovered. I didn't change any of his thinking. In fact, the sessions were kind of no-brainers. I'd just say, so, how much walking have you been doing? How did you get yourself to do the walking? How did you knock the depression devil off your shoulder when it said, oh, the walking won't work? What did you, And so we go through things like that. And I thought, oh, this is a kind of a remarkable outcome. And it was only about exercise. That's the only intervention we did. I don't say that that's going to be true of every patient, but in that particular case, that was an interesting outlier. Your comments?
That's a beautiful example. I love it. Yes, walking. What are you? There's so much. It's great. Not only are you walking, but in his case, you're walking with your spouse. You have that social connection. Maybe you notice something beautiful along your walk. So walking can be a moving meditation. It's wonderful. We know there's so many studies linking the value of exercise and connection with exercise and your mood. Yoga is the same. There's a lot of great studies about yoga for depression, yoga for anxiety. When you exercise, you also become part of a community, so then you get that benefit too, because maybe now you're talking to people if you're going to the gym or you're out taking a walk. So there's many more opportunities for positive experiences or a sense of connection, a sense of belonging.
Now, for some reason, you didn't fill my screen when you were talking. I don't know why that is. Let's see here. Present to everybody. Now say something.
Okay. Is that better?
No, you're still little. I want you big.
Well, now I see me as big, and now
Okay.
I see you as little.
Yeah, well, that's the way it should be. And
Okay.
and you are the big expert. Well, no, I mean you look like a very normal-sized woman. You're the intellectually experientially big expert here, so that's the way it should be. So we've got food, we've got physical exercise, and you hinted about a few other things. What about this social connection business?
So, well, having a sense of community is just so important. As we know, the difficulties of being isolated. So in functional medicine, that's one of the factors that's looked at, how you connect, how you have a sense of community. And so we try and foster that, although it doesn't necessarily, it's our value system. We don't want to impose that because some people can be perfectly fine as researchers, and they may have a cat or a connection with a dog. It doesn't have to be necessarily, as someone would say, would be, having the importance of a large community of people around them. Some people are more introverted and would not thrive in that way.
So expanding your community is a possible intervention, and it may interact with introversion, extroversion. What else?
Well, I help people look at their strengths. So I've always been a strong advocate of positive psychology. I teach a course in the psychology of well-being where we look at the essential character strengths. So helping someone to be courageous. Can you have 20 seconds of courage, be brave in difficult situations? But the main difference regarding the functional medicine perspective is the looking at how these factors, this is not just functional medicine, but the whole mind-body medicine, the idea that you change your thinking, you change, like your example of you start walking, well, you are now not only feeling less depressed, but you're also driving down inflammation. I think healing the gut is very, very crucial. So there's we make our neurotransmitters, most of them, in our gut. Most people think they're in the brain, but we have an enteric nervous system. We build serotonin in our gut. So if we have digestive issues, then that is going to be a red flag. Then those need to be addressed. So in my intake, that's something I will always address. And from functional medicine, there's a nice questionnaire. It's a medical symptoms questionnaire, and it's tracking how many systems are involved in as being how people are rating their particular symptoms. So we're looking at, someone comes in and says they're depressed, and we'll ask, well, how's your digestion? Any difficulties with, diarrhea, constipation? We'll have, if I see on a checklist, I'm constipated. I only go to the bathroom once a week. That's normal, isn't it? And, well, no, that's me. There could be some issues with your detoxification pathway. And that's a whole other area, too, that we're just beginning to look at. For example, methylation issues, where that means you cannot convert folic acid to an active form of folate. That's going to interfere with your ability to build neurotransmitters. It's also going to interfere with detoxification. So I suggest, again, that they go back to their physician and get some tests. These are common tests now that you can get through the common labs. Many of them are covered through insurance. And when you find that out, that's going to be the answer is simple. It has to do with the taking the active form of folate as a supplement. So that's going to have a huge impact.
Is that an over-the-counter supplement, or is that?
Yep.
Okay. Well, but how do you know if there are methylation issues? What's the test that you would recommend?
You would get an MTHFR test, which is it's a genetic test that's become very common, and it's very common for people to have these variations. They're called single nucleotide polymorphisms, or SNPs. They're very common. So if you are heterozygous, meaning you've got this from both parents, then that really increases your risk. You have a 70% chance that you are going to be in this group that doesn't methylate well. And so it's a concern if you're thinking of getting pregnant. You want to make sure that you're taking prenatals that have the active form. So when you look at a vitamin bottle, it has to be have 5 the active form, which is 5-methyl tetrahydrofolate. But without boring you with all these technical details, it's just something that I like to just. It's a red flag, and I like to educate people. Not that I'm acting as a nutritionist or I'm giving them the prescription or for going to get these lab tests, but just educating and making them aware of some of these.
Well, but it does sound as if you've really had to educate yourself thoroughly on nutrition and thoroughly on things like digestion and the gut health. So again, how do my listeners start to master this? Where do you think they should turn?
Well, I think that there's the first is to just start to be aware of when someone comes in and they say they're depressed or they're anxious, that there might be something going on with their whole life. We're not just looking at this one area of, okay, what's going on with your thinking, or what was your mother like, but we're really just simple, like, do you eat breakfast? What's tell me about, do you do you exercise? Do you move during the day? Do you sit all day? So just some of these very simple questions. How much sleep do you get? Do you drink water during the day? So just some basic questions about their diet, their lifestyle. Many people eat no breakfast, or most people will have, they'll have a carton of yogurt, they'll have some instant oatmeal, some fruit. Well, they're eating dessert for breakfast. Most people, we need protein. Our brain is heavily dependent on protein, the right fats. So, some people may need to be referred to a nutritionist, and so that's, I think as a psychologist or as a therapist, starting to ask questions, but then based on those answers, it might be very, very helpful to suggest a consultation with a nutritionist. What I am starting is a program for function. So my program was for certification through the Institute for Functional Medicine. That's primarily for physicians, and I'm starting a coaching program. It will lead to certification as a functional medicine health coach. So if someone, this is a program that will be more suited for therapists who are interested in making the switch to health coaching or incorporating some of this into their current practice.
Oh, wonderful, wonderful. You are affiliated with the Institute for Functional Medicine. People could go there. And
so that's the good place to start. You can go to their website. It's functionalmedicine.org. And then I'm personally working on developing a health coach program that will teach the basics of functional medicine, along with some nutrition and art of coaching, which is very different in many ways from therapy, but in many ways it's very similar. So, but the differences in coaching, we're guiding someone from where they are to where they want to be. We're not focusing on a diagnosis and a treatment plan for someone with a mental condition. And the program will also have elements of mind-body medicine and positive psychology.
That's very interesting. I mean, it seems to me like you're implying that a good place for therapists to go to work would be in a medical clinic.
Well, that's that's the future, according to many analysts. That the old model, as you and I knew it, and I was trained, back in the 70s, and you have your little office, you have a 50-minute hour, and you see your private clients, and that is becoming more and more difficult as we are getting into new healthcare delivery systems, and so. For therapists to become part of medical practices, joining primary care physicians. I have joined many years ago. I was working with an oncology practice, which is why I was doing so many psychosocial oncology hospital consults. So it's merging so that I've worked. My office has often been in exam rooms, and I'm working with patients with physical illnesses. And in psychology, there is a diagnosis, or is a treatment and a diagnosis code for that, or an intervention code for that. It's a health and behavior intervention. So we're addressing medical conditions, but using the behavioral strategies that we've been trained in.
Yeah, that's interesting. One of the weaknesses of medical doctors is that they don't really have much training and education in how to motivate people to make behavioral changes.
Exactly. So I was just at a conference the past weekend through the Cleveland Clinic, and one of the presenters spoke about the fact that when a patient leaves the physician's office, they will have forgotten 80% of what they were told. It's also been said that patients remember how a doctor makes them feel much more than what that doctor has actually said. And functional medicine is very much about changing that and bringing back the doctor-patient connection. And psychologists and therapists are, of course, are trained to establish that connection, and that's why for many who want to make.
Oh, so she froze up again. Um, so basically, what I guess we would learn from this is, and I hope she figures out that she froze up again and reboots, rejoins us. But the bottom line is this. This is kind of an exciting area for therapists to start thinking about for two reasons. And one is maybe some of the folks that we haven't been able to help could be helped with a functional medicine approach, like the example of the 67-year-old gentleman that I saw a few years ago. Scott Miller and I actually put that very case into an article that I published in Psychotherapy Theory? No, I don't remember where I published it. Anyways, in some journal, and and it was such a shocking kind of case because all I did in that case is have the poor fellow walk. And here she comes. She's back. She's back. I love it. Okay, welcome back.
All right, great to be here.
Well, we've got about 4 minutes left on our call. Now, if anybody has any questions, type them into the chat bar, and I'll see them. And with any luck at all, Sandra will see them. And if she doesn't, I'll read it to her. Okay. What about paper pencil stuff to make people a little more skilled at this? Do you have any checklists or instruments that you would be willing to share? What's your advice to us on that?
So, well, I have I always use an intake questionnaire that is, and I think if you some of these are proprietary through the Institute for Functional Medicine, but someone can go in and go to functionalmedicine.org, and there are many things on that website. If you join as a member, you get a whole toolkit that you can download, which includes the medical symptoms questionnaire. There's the functional medicine timeline for telling a person's story. What I have used, because I do focus on positive psychology, I have a strengths checklist that I have as a journal, and I can share that. It's, how have you used your strengths today, or how do you intend to use your strengths today? And I look at the positive psychology from Martin Seligman's work, the 24 character strengths and virtues, and keep that front and center. I think the EWG.org is a wonderful resource that people can go to. That's the Environmental Working Group, and you can get a list of what's called the Dirty Dozen, the most pesticide-laden fruits and vegetables. They also look into personal care products, so that's a great place to start as well. Also looking at the work of Mark Hyman, who's my friend and mentor. He's the chairman of the Institute for Functional Medicine, and he's written a number of New York Times best-selling books. I will also have a book about specifically panic attacks. It's called Stop Panicking in 10 Easy Steps. It's incorporating all of the principles we have spoken about, including the mind-body medicine principles.
So you're bringing that book out?
Yes, I will bring that. That is going to be released in April, and it's a functional medicine guide to drug-free, easy techniques for stopping panic.
Well, when that comes out, give me a heads up, and I will send out an email on it to all the folks that read my email newsletter.
Thank you
I've
so
got,
much.
it's kind of like I've got 6,000 people on my newsletter list, and I think 30 or 40 of them actually open the newsletter.
Yeah.
So I wouldn't get my hopes up about becoming a bestseller just from my list, but still,
Well,
I want to let people know
that's a good rate of return. 30 or 40 open up your newsletter. That's pretty good.
yeah, and it's probably a lot better than that. It's probably a 20–30% of people will open the newsletter. So it may be 1,000, maybe 1,500, who knows. But the point is, let's keep people informed about this sort of thing, because I think really this is a very fascinating future of medicine direction that we're going. And I'm a great believer in this.
Absolutely. By 2020, it's estimated 1 in 2 will either be diabetic or on their way with metabolic syndrome. We are facing a tsunami of chronic disease that modern medicine it just does not know how to handle. And I think therapists are very well positioned to train to be at the forefront of changing healthcare and helping people move towards wellness.
Well, let's wrap this up. Let me just mention then everybody has that, and it was, let's see here, functional medicine website. I hope that everybody does, because I posted it on the chat bar there. And so Institute for Functional Medicine, Environmental Working Group, ewg.org, and maybe I'll nag Sandra to send me some links and things like that I can post into my blog. Let's thank her for spending her time today. I thought it was fascinating. It was enlightening. You're getting good results with this, aren't you?
Absolutely. I've seen people change, get them to look at their diet, eliminate sugar and dairy and gluten, and they come back a few weeks later and they say, boy, I'm feeling so happy. I'm feeling so good. I'm so calm. I'm feeling peaceful. It's amazing. The body wants to heal. So,
so thank you all, and thanks to Sandra, and what a generous person she is to share an hour of her time with us.
Thank you so much. It's a pleasure to speak with you.
All right. Bye-bye now, everybody.